If you live with type 2 diabetes, have you been told to give up milk completely? Or, on the flip side, have you seen videos promising that one special milk can melt your diabetes away? Here is the truth that sits right in the middle. The wrong milk really can spike your blood sugar, but the right milk, taken the right way, can actually help you keep it steadier. No milk on earth will reverse or cure type 2 diabetes. Anyone who tells you that is selling something. But choosing wisely at the milk aisle is one of the simplest, cheapest changes you can make today. Back in 2018, researchers at the University of Guelph and the University of Toronto, publishing in the Journal of Dairy Science, found that drinking milk with breakfast cereal lowered blood sugar after the meal compared to drinking water with the same cereal, and a higher protein milk lowered it even more. A glass of milk used smartly behaves like a quiet blood sugar buffer. What your body does with milk at 45 is not what it does at 70. Today, we will walk through the 5 best milk choices for blood sugar, ranked from a solid, dependable option all the way up to the single most powerful approach that the strongest clinical trials point to. And that number 1 is not a brand, and it is not exotic. It is a way of drinking milk that researchers have tested in people with diabetes and prediabetes. Number 5. Lactose-free or ultra-filtered cow's milk. The dependable starting point if you do not want to give up the real thing. Regular cow's milk carries about 12 grams of natural sugar called lactose in every cup. That lactose is a carbohydrate, and carbohydrates are what move your blood sugar. Ultra-filtered milks, the kind sold as high-protein, reduced sugar cartons, physically filter out some of that lactose while concentrating the protein. So you get more of the protein that slows digestion and less of the sugar that raises glucose. Lactose-free milk works differently. The sugar is still there, but an added enzyme pre-digests it so it is gentler on your gut, which matters more as the digestive system gets fussier with age. The research backs the protein angle. That 2018 Journal of Dairy Science work from Guelph and Toronto showed higher dairy protein milk blunted the post-meal glucose rise more than ordinary milk. And a 2019 study by Storius and colleagues in the journal Nutrients found that concentrated milk protein from whey actually lowered HbA1c, your 3-month average blood sugar, in people with prediabetes. Protein is the hero of this story, and these milks are built around it. Age matters here. After about 60, 2 things happen at once. Your muscles start to thin, doctors call it sarcopenia, and your body tends to handle carbohydrates a little less efficiently. A higher protein, lower sugar milk helps on both fronts, feeding muscle while easing the sugar load. How to start today. On your next shopping trip, pick up 1 carton of unsweetened, lactose-free, or high-protein ultra-filtered milk and read the label. You want sugar low and protein high. Use it exactly where you already use milk. Synergy tip. Pair this milk with the protein timing trick we will reach at number 1, and you multiply the benefit. Number 4. Fermented dairy drinks, plain kefir, and unsweetened drinkable yogurt. Fermented dairy steps it up. The mechanism is fascinating and simple. Fermentation means live bacteria have already eaten through some of the milk sugar before it ever reaches you. And those same bacteria, your probiotics, settle into your gut and help shape how your body handles glucose and inflammation. A fermented milk drink tends to land softer on your blood sugar than the same amount of plain milk, while doing extra work downstream in your digestive system. Large observational studies have repeatedly linked regular yogurt eating to a lower risk of developing type 2 diabetes, and a randomized controlled trial of probiotic-enriched fermented soy milk in people with type 2 diabetes, published in the Journal of Renal Nutrition, reported improvements in markers tied to blood sugar and inflammation over an 8-week period, compared with the non-probiotic version. Live cultures earn their keep. The diversity of helpful bacteria in your gut tends to shrink after 65, and that shift is linked to worse blood sugar control and more inflammation. Fermented dairy is one of the easiest ways to feed those helpful microbes daily. How to start today. Buy plain, unsweetened kefir or a natural drinkable yogurt. The ingredient list should be short with no added sugar. Have a small glass with a meal. The word to hunt for on the label is unsweetened. because flavored versions can hide more sugar than soda. Synergy tip: fermented dairy and high-fiber pairings feed each other. Fiber is food for the very bacteria you are adding. Number 3. Unsweetened almond milk. This is the lightest option on the list, and for some of you, it will be the easiest win. The mechanism is simple. Almond milk is mostly water with a little ground almond, so it carries barely any carbohydrate. Unsweetened almond milk has less than 1 gram of carbohydrate per 100 milliliters, compared with roughly 5 grams in semi-skimmed cow's milk. Less sugar going in means less sugar to manage. The catch is in that one word, unsweetened, because sweetened and flavored almond milks can carry as much added sugar as a soft drink. Nutritional analyses consistently rank unsweetened almond milk among the lowest carbohydrate milk choices available, which is why diabetes dietitians so often reach for it first. A 2023 systematic review in the journal Nutrients, examining plant-based milk substitutes and blood sugar response, concluded that low-carbohydrate options like unsweetened almond milk have minimal impact on glucose. One honest caveat: almond milk is naturally very low in protein. After 60, your protein needs actually go up to protect muscle. So almond milk is a brilliant low-sugar mixer for coffee, tea, and cereal, but do not lean on it as your main protein source the way you might with cow's or soy milk. How to start today: replace the milk in your coffee, tea, or breakfast cereal with an unsweetened almond version. It is widely available and often costs about the same as dairy. Synergy tip: use almond milk as your low-sugar base, but get your protein from the next option on the list, because number 2 gives you that ultra-low sugar profile and a full dose of protein in the same glass. Number 2. Unsweetened soy milk. For most people with type 2 diabetes, this is the best all-rounder in the entire milk aisle. Soy milk pulls off a rare double act. It is low in sugar, only about 2 to 3 grams of carbohydrate per 100 milliliters, and yet it is one of the only plant milks that delivers a complete, high-quality protein, the kind usually found only in animal foods. That protein slows digestion and softens the rise in blood sugar, while the low carbohydrate count means there is little sugar to spike in the first place. Nutritionally, it is the plant milk that comes closest to replacing cow's milk. A 2021 meta-analysis in Nutrients, pooling many randomized trials, found that soy did not produce a large, reliable drop in fasting glucose or HbA1c on its own. So soy milk is not a magic blood sugar cure. But that same body of research found something else clearly valuable. Soy significantly lowered total cholesterol and LDL, the harmful cholesterol. And a separate 8-week randomized controlled trial found soy protein improved HbA1c compared with dairy-based casein protein. Heart disease is the #1 threat to people with diabetes. Soy milk protects the organ diabetes endangers most. After 60, both rising cholesterol and shrinking muscle become bigger concerns. Soy's mix of complete protein and cholesterol-lowering effect speaks to both at once. How to start today: choose an unsweetened, fortified soy milk. Fortified means calcium and vitamin B12 added back, which matters if you are using it to replace dairy. Use it anywhere you would use cow's milk. Synergy tip: soy milk is the perfect partner for number 1. Number 1. The protein preload. Not a brand, not a secret ingredient. The most powerful approach in the research is this. Drink a glass of unsweetened, high-protein milk, dairy or soy, just before or alongside the carbohydrate part of your meal. Researchers call it a protein preload. The mechanism is clear. When protein hits your gut a little ahead of your carbohydrates, it triggers gut hormones that tell your stomach to empty more slowly and prompt your body to release insulin sooner and more efficiently. The result is that the sugar from your meal trickles into your blood instead of flooding in. You have not removed the carbs. You have changed the timing of how your body meets them. Milk rich in whey protein is one of the best natural triggers for this effect. A 2014 randomized controlled trial published in the Nutrition Journal gave people a small whey protein drink before a high-carbohydrate breakfast, and their peak blood sugar dropped by about 2.1 millimoles per liter, with average glucose over the next 3 hours meaningfully lower as well. All from one modest 80-calorie preload. The 2018 Guelph and Toronto study found the same pattern with milk at breakfast. Higher protein, lower post-meal glucose, and steadier blood sugar even after the next meal, hours later. After 65, that early, efficient insulin response naturally weakens. Anything that nudges your body to release insulin on time becomes more valuable. A protein preload does exactly that, gently and for free. How to start today. Tomorrow morning before your highest carb meal, drink a small glass, about 150 to 200 milliliters, of unsweetened high-protein milk, ideally the soy or ultra-filtered dairy from earlier in this list. 10 minutes ahead is ideal. Alongside the meal still helps. This is where the whole video clicks together. The best milk from numbers 2 and 5, the gut support from number 4, the low sugar base from number 3, all of it pays off most when you use it as a preload. That is the synergy. Summary number 5. Lactose-free and ultra-filtered cow's milk. More protein, less sugar. A dependable place to start. Number 4. Fermented kefir and plain yogurt. Lower sugar plus live cultures that bring your gut into the fight. Number 3. Unsweetened almond milk. The ultra-low sugar choice for your coffee and cereal. Number 2. Unsweetened soy milk. The best all-rounder, guarding your heart while it steadies your sugar. Number 1. The protein preload. Using a small glass of unsweetened high-protein milk before your carbs. The trick with the strongest science behind it. Closing. No milk reverses diabetes, but the choices you make at the milk aisle genuinely move the needle. It is never too late to start. Whether you are 50 or 85, your body responds to better choices. Every steadier morning counts. Managing your health is not about one miracle. It is about one honest, doable choice repeated.